Hi everyone, again, this is Dr. Joseph. I'm one of the pediatric dental resident at NYU Langone in New York City. Again, in the middle of this pandemic and just trying to, help each other and help decrease the spread of the disease. Today I'm going to talk to you guys about this thing we call Cambra, so caries management by risk association. Caries management by risk association. So the prevalence of dental caries, it's 5 times more common than asthma. People, uh, you know, sometimes underestimate how common dental caries is, especially in kids. Like this little kid, I've seen kids, they're 2, and they just got the teeth and it's completely bombed out. We'll go over the difference between early childhood caries versus severe childhood caries. It all had to do with the age. If they have white spot lesion, enamel defects before the age of 3, then it's severe early childhood decay. If it's before the age of 6, then it just early childhood caries. We'll go over that later on. And as I said, it attacks the younger kids. And in 3 to 5, it's more prevalent as well because as they're going to school and they have more freedom for what they're eating. And then it's a host of a bunch of things. It's not just one thing. We used to think it's one organism, or it's you're eating a lot of sugar. But if you put in the petri dish, you just put just the just the just the tooth itself, it's not gonna get cavity. Just high sugar intake without the teeth, you're not gonna get cavity. Just the bacteria themselves, it's not gonna get cavity. You have to have all 3. It's a combination. So caries risk assessment is the best predictor for future caries. Looking at based on past caries experience. So your past caries experience is used to predict your future. And then the challenge is trying to predict future caries experience. That's the challenge. And the thing is with caries is a balance. It's a balance for the things that are pathological and protective. As we all know, for protective, we have saliva, fluoride, antibacterials, or hygiene. If someone has a dry mouth, increases the risk. Not exposed to fluoride, increases the risk. And they're not brushing. On the other side, the thing that's going to cause cavities is if they have high sugar to frequency, not so much the load, the frequency of carbohydrate, poor health literacy. So the parents just are not informed that they're supposed to bring in the kid early. I have a lot of parents that come in when the kid is 5 years old, 6, and I tell them, we recommend establishing a dental home early, no later than 12 months old. As soon as those teeth are erupted, they don't know. You just have to educate them. You understand? Once again, circling back to this, caries management by risk assessment. So you assess the risk for dental caries in the future, interview and clinical exam. So it's both. You interview the parents and the clinical exam. Then alter the balance between caries, pathological, and protective. So you want to alter this. But strength evolving with more evidence-based recommendations. I have some links for you guys here. And weakness, sibling risk is not included in the risk factor. Again, the balancing fact. if you've had previous restoration, you're high carriers risk. You have decalcification, you're high carriers risk. You have cavitated lesion, you're high carriers risk. All of those things, if you have all those things, decalcification, and then your diet frequency. When you have decalcification, restoration, and high diet, and if you do that before the age of 3, you have those before the age of 3, you are severe early childhood decay. If it's before the age of 6, after the age of 3, then it's early childhood decay. Pay attention to that. And again, the protective factors. Care risk assessment by age, 0 to 5. You look at the caregiver care status. Do they have cares? That's important because the number one transmitter of cavities are the caregiver, the mother who's ever taking care of the kid. Something we call vertical transmission. This is very important. Vertical transmission. If you don't take anything out of this lecture, take away vertical transmission because you're going to transmit, a caregiver will transmit the bacteria, which is S mutant, Streptococcus mutant. We'll look into that later on. From the caregiver, mother to the child. You know, when they start here, they do have bacteria, but they don't have carcinogenic bacteria as of yet. But the mother will transmit that to them. They can have that even before, prior to the eruption of the teeth, can be transmitted. And then child bottle usage, if they use, bottle at nighttime, that's why we used to be called bottle cavities, bottle caries. They changed. And greater than 6, you look at caries history. This child had, how often they had caries, frequency of snacking and juice, orthodontic appliance, space maintainers, interceptive orthodontists, older kids, and adults, recreational drugs, meth. It's really detrimental. So now we're looking at our teenagers. And then care risk factors, you can look at that as I spoke about. Nighttime feeding, really bad. There's a correlation there. Parental education, you have to educate them so they know, like sugary, they can have it. You just tell them not frequent. For instance, if the kid is between the age of 1 to 3, you give them 4 ounces once a day, 4 ounces total a day during a meal, either lunch or dinner. And if the kid is between the age of 3 to 6, you give them 4 to 6 ounces. No juice should be introduced to any child prior to the first birthday. So before first birthday, no juice. It should only be breastfeeding, exclusive breastfeeding. And breastfeeding is not associated with early childhood caries. Breastfeeding is not associated with early childhood caries. The way I remember how much ounces, the way I do it is I say 1 to 3. You just have to remember 1 to 3 years old. You give them 4 ounces. 1 to 3, 4 ounces. And then you go 3 to 6, 4 to 6 ounces. Once again, vertical transmission. Lateral transmission is the other thing. Vertical from the caregiver, laterally. Think of daycare. They're licking all those toys. All these toys, they're licking them. They're going to take the vertical transmission from the respective homes and then share among them. That's lateral transmission. Horizontal transmission of Streptococcus mutans and also siblings as well. So how does the infection occur? Transmitted mainly from mother or primary caregiver. As I said, after this lecture, if you're going to take away one thing, vertical transmission. Mother will make the food and mix the bowl for the child. Taste the food in the mouth first, or blow it, and then transmit the saliva to the baby, to the infant. Transmitted via utensils, showing love, kissing the baby, all that, you transfer the bacteria that way. And the bad people are Streptococcus mutans, and Streptococcus subrenans. As a whole, they are called strep mutants. And caries can be infectious process, mutant streptococcus, they will initiate the bacteria. So the bacteria plaque has multiple decay. Before, we used to think that it's just one single pathogen that caused it, but now they know in the plaque biome, there are multiple bacteria. One that are for initiation, like the mutant streptococcus, and the one that are for progression, lactobacillus species. And again, this one just putting it to words so you have it to study. The disease of early childhood caries, ECC, is the process of one or more decayed, non-cavitated or cavitated lesions missing due to cavities, extracted deep decay, or failed tooth surfaces in any primary tooth in a child under the age of 6. That's ECC. In children younger than 3, though, any sign of smooth surface caries is indicative of severe early childhood caries. So under the age of 3, the cavities will most likely be on the smooth surfaces. Sometimes you get it on your clothes on the back teeth. Those are the ones that are very frustrated because you say those teeth literally just came out, erupted. Most severe risks for ECC, as we said, parent with caries, because they're going to give it to them. Elevated mutant streptococcus, those are tests, you can do it to test for that. Again, with severe ECC, you have more variety, more diversity of bacteria being transferred to the kid, and high consumption of sugar, enamel hyperplasia, quantitative defect of enamel during apposition, some social factors, they just don't have access to the dentist or like any social factor. So you want to study that when you have a patient in. And also to remember that breastfeeding is not associated with ECC or SECC. Just remember that. You want exclusive breastfeeding before the age of 1. And then by 1 to 3 years old, you want to limit the daily juice at 4 ounces with a meal. And then 3 to 6, you want to limit that to 4 to 6 ounces daily with a meal. That's the American Academy of Pediatric Dentistry recommendations. And with the high caries, again, bottle to bed, very high caries, the juice box, bad, consumption of, chocolate, bad, smooth surface carie, bad. And then this is the caries risk assessment, looking at things. The high caries risk are very obvious, low caries risk, it's obvious. Moderate risk usually would be special healthcare need, and someone that just recently immigrated to an area that they're not integrated to the area yet. Plaque used to be moderate, but I believe now it's considered high caries risk, and then this one is greater than 6 years old. And again, this is fluoride, fluoride recommendations. Under the age of 3, in general, no one has a business to have this much fluoride, like the one the toothpaste companies have. That one they're trying to make money. They're trying to make money, so they show how much you're gonna use, so you can keep buying new tubes. That's a whole gram. It's very toxic. So you want to give a kid under the age of 3, you want to just do a smear. This is what a smear looks like. Demonstrate to the parent. And it's about 0.125 milligram. Even if they swallow the whole thing, it's fine. Pea size on the other side, on the other end, it's just a little pea size. Demonstrate that again to the parents greater than 3 years old. That's 0.25. Smear pea. 0.125 times 2 is 0.25. So It just keeps it simple, no more than that. Disciplinary guidance, we went over that. You can just read it, and that's 3 to 6 years old. Questions? Again, just one of the overall basic. Again, just the vertical transmission. Know the vertical transmission of Streptococcus mutans. From mother to child, and then one thing I failed to mention too is with caries, the kids this young with multiple decay, you educate the parents. You tell them we have to take your child to the operating room, put them to sleep to fix those teeth, and just educate them. So if in the future they're gonna have more kids, or they know someone, they can hopefully educate the other people. You know, because normally in pediatric dentistry we do quadrant dentistry, each quadrant at a time, and we commonly use nitrous oxide. But if a kid has severe ECC or ECC, yeah, behavior is not good, you have to put them to sleep under general anesthesia to treat them. And I would say dental caries is 5 times more common than asthma. Guys have any questions for me, you can email me. I'm gonna add the email to the first page and send it to you guys. Thank you.